Hi, my name is Gutovitz. I'm from Overland Park, Kansas. I'm in stage intern year at Sheba. I'm in my last 2 days of intern year right now. So my time at Sheba is coming to an end for now. And it's an emotional time, mixed feelings. It's been an amazing experience here. Very lucky to have done stage here at Sheba. I'm really blessed to have been here. So the cool thing about working at Sheba is that every moment is infused with meaning and purpose, and especially during this difficult time, it's been incredibly meaningful work and fulfilling work. Most recently, I've had 2 back-to-back incredible interactions. This was all in one night shift in the ophthalmology ER. We were working with one person who was injured in the war, and they had what's called an optic nerve avulsion, which is when the optic nerve, the part in the back of the eye that connects the eye to the brain, gets disconnected. And it's very, very sad. You totally lose vision in that eye. And just talking to people now, you get so much perspective. So to talk to this person and hear his story, and he was saying, "Thank God I have my other eye." He was saying, "Thank God I was treated, and thank God I'm able to recover as much as possible, and I'm really grateful for what I do have." So I think often with patient interactions, there's sometimes a bit of impatience, especially at 3 o'clock in the morning, 4 in the morning. On a tough night shift, you can lose sight of what your purpose is here. But when you see someone and you hear their story and you understand this person is going through so much, you kind of internalize that and you say to yourself, I should be giving this person my whole heart. I should be giving them all of my attention. I should be giving them the best care that I possibly could. And that applies to anyone and everyone, but it's kind of a wake-up call when you see really how difficult the things people are going through are. And it makes you want to just give them all the more love and all the more compassion. And I think that's something to take in every patient interaction moving forward, because everyone's going through something. So that's one. And then if I can share one more patient interaction that was right after that one, there was a 100-year-old Holocaust survivor who came in to the ophthalmology ER, and I was reading the patient file before seeing the patient, and in what they wrote from the ambulance that brought him to the hospital, they wrote that he fell and he got hit and he got up, and this patient walked out to the ambulance with the ambulance drivers, and he opened the door for the ambulance drivers. And this is someone who's 100 years old, who survived the Holocaust, has been through everything. And his initial reaction is, what can I do for somebody else? Can I open the door for the ambulance driver? Can I pick up something that someone dropped? What can I do for someone else? And again, especially in very difficult times, to be able to build up the courage and to build up the selflessness, to not say, what can I do for myself in this moment, but what can I do for someone else, even if it's something as simple as opening the door for the ambulance driver. It's a really special mentality, and it's something we've seen a lot of lately. So I think taking that into my future medical career, always asking, what can I do for my colleagues? What can I do for my patients? What can I do for my family, my friends? And that's just a meaningful way to approach life. Coming back to Sheba would be an incredible honor, and I would love to come back to Sheba down the road. But I think it's the combination that every doctor wishes they have. It's the ideal that we aspire towards, which is compassion and competence. And at Sheba, you see compassion, competence, and mastery and motivation and a desire to make an impact, not only on your patients, but on medicine at large. And that's something I've loved at Sheba. I've been mostly motivated and mostly trying to spend time in the ophthalmology department. That's the field I love. It's what I'm passionate about. It's what I find fascinating. And so many of the doctors here in ophthalmology, and not only are they leaders in their field, they're also willing to take the time to smile at you when you walk through the door. They're willing to take the time to stay after a long day in the operating room and work on your suturing techniques. They're willing to guide you, to mentor you. And that's why I love to come back to Sheba. It's this combination that so many of the mentors I've had here have, which is compassion, competence, and a drive to do so much more than just the interactions they have with their patients on a one-to-one basis. They're motivated to pioneer medical innovation. They're motivated to educate students. They're motivated to do so much. And that's something I definitely hope to carry into my career, to not only see my own patients, but also to try to contribute everything I can. Life is short, and we want to do as much as we possibly can while we're here.